The United Nations is expanding its sexual health intervention programs to the innermost slum areas in Lagos State. According to the United Nations International Children's Emergency Fund, in charge of community outreach, these areas have been shown to be the most vulnerable to deadly sexually transmitted diseases as a result of poor living conditions and need urgent intervention to curb a possible widespread re-emergence. News Central's Adesewa Odusoga tells us more.
Africa's largest city, Lagos, houses one of the most unconducive urban slums on the continent. With a large rate of rural to urban migration recorded daily, these informal settlements, which are mostly overpopulated, are faced with environmental, health, and security challenges. One of them is Ajerami Felodun, a community located on the outskirts of the city in dire need of basic interventions. These include sexual health interventions, especially among adolescents who are sometimes victims of sexually transmitted diseases or unwanted pregnancy. Forming part of a community outreach program, the United Nations, through UNICEF, visited the community to sensitize residents on the risk of HIV and AIDS, and also to include the prevention of COVID-19.
In this urban slum, where we have a lot of challenges, very crowded living and a very poor water sanitation, it's really primarily is for the government and local government to take the responsibilities. And wherever there is a gap, or whenever there is additional areas that UNICEF can support, to support the government and the civil societies, we should do so.
This is the role of UNICEF. It has always been. When we say children, adolescents are also part of the children population, a little bit bigger. They are growing to become adults, but not yet there. So we as a community, we need to ensure the well-being of these young people are assured.
Volunteers in the community say this is important to raise awareness and curb reckless and indiscriminate sexual interactions among its youth.
HIV is one of the virus around this locality that most people don't know they're actually living in it. Once we hold outreaches like this, it prompts them, it moves them to want to come out, because seeing the crowd, seeing different tests being carried out for them, they want to come out, to come and test themselves. But going to meet them one-on-one, they might be reluctant.
I'm not sure I have HIV, but nonetheless, you must find out if you have HIV or not, because there are some things I always do, like sharing of razor blades, all these harmful things. So it's not about sex. So I just came to confirm.
Residents here believe they need more interventions like this one to raise awareness of the possible risks and dangers of the transmission of sexually related diseases. Adesewa Odusoga reporting for News Central.